Happy Thursday! We've made it another week. For those of you that were able to join us at the annual meeting, we really appreciate you taking the time to do that, and we hope you enjoyed yourselves. All right, let's jump right in. The Inspector General let us know that due to the increase in cases across Kentucky, they will be postponing annual surveys until further notice. So don't be expecting any knocks on your door, at least for the time being. We'll let you know if that changes anytime soon, but I expect with the increase in cases and then with winter coming and flu season upon us, that probably will not change until the spring. They also let us know that federal support for the Battelle critical care decontamination system, the N95 mask decontamination system, will stop on December 1st, 2020. That's this coming December because of funding. There was a lack of funding for that. So November 30th, 2020 will be the last day for masks to be sent in for process or for them to be received there for processing. So if you happen to be using that system, just know that that will be ceasing, and November 30th is the last day. And any masks received after that will be destroyed. So please don't send them in after that. The IG also let us know, and the Department for Public Health let us know that there have been several issues that they've recognized around reporting on the SurveyMonkey survey. That's that daily, I know you all know which one I'm talking about. It's the daily survey that you guys have been doing. So they've asked that we pass these messages along to you so that you can correct these issues. So the first one is on the daily SurveyMonkey. There are a few facilities reporting the cases that are transferred within their facility to their COVID unit from other facilities. I'm sorry, not within their unit. So from other facilities, but often sister facilities. And then some other facilities are often not reporting their cases once a positive patient is transferred out to a COVID unit in another facility or hospital. They wanted to make sure we knew that this could lead to an undercount or an overcount of cases in the daily long-term care facility report. So they wanted to remind all of us that we need to continue reporting residents on your survey, even if they are transferred to a COVID unit in another facility. So I think if they are your resident, and even if they're transferred, if that resident intends to come back to you once they are recovered from COVID, they should be counted on your report. I hope that makes sense. If you have any questions, please don't hesitate to reach out, and I can answer those or seek clarification from the folks over there at DPH. Okay, and another issue was that there are also a few facilities that are not regularly reporting on that SurveyMonkey survey. So just make sure you're doing that. I know that's the report that the governor uses, the data off of that report to give his press conferences. And they also made sure that we knew that because on that daily report, they, you want to make sure that your data is accurate because that data that they have, the last data that they have entered, may not reflect your current case mix or the current number of active cases in your facility. So just make sure that you have all of your current information in that survey as best you can. We all know that everybody is just overrun with stuff to do. All right, CDC came up with an update. CDC recently updated its interim infection prevention and control recommendations for healthcare personnel during COVID. I put a link in this update for you. There were just a couple things that they updated. They provided different options for screening individuals prior to entry. Nothing earth-shattering, nothing. I went through this kind of with a fine-tooth comb, and one of the things that I noticed was like if you take a temperature. So one of the other things they provided information on are factors that could impact thermometer readings. And I noted in here the ambient environment, such as if you were screening temperature outside in a very cold temperature. Now that we have outside visitation that's going on or that's mandated in a lot of situations, it's starting to get really cold out. So if you're taking folks' temperature as they come to visit, that could really affect the screening. So just keep all of that in mind. And then I tried to go through it and list the most pertinent information from this alert or this updated guidance in this alert. Oh, lots going on today in this alert so that you didn't have to parse through that guidance and you had it all right here. But if you have the time, go through that guidance with, in your own time so that you have it in your own mind. All right, point of care test reporting. Remember that your point of care testing results are required as part of the NHSN system for those of you that are Medicaid certified facilities. We've talked about this several times in prior weeks, so this is just a reminder, but the reason that I'm talking about it this time is that you will, this is supposed to be done by November 20th. So enforcement discretion is supposed to be starting November 20th. So just make sure you have that done. In order to do that, you'll remember that you have to upgrade from level 1 access to level 3 access. And then there are some instructions in this alert for how to do so. All right, the third thing is that OSHA went ahead and released COVID-19 respiratory protection guidance for long-term care employees. This is, they released a resource that went through and kind of explained requirements around PPE and includes the key elements of the respiratory protection program. The resource includes temporary enforcement discretion related to the respiratory protection standard during COVID-19, and there is a template included. I wanted to make sure I called your attention to that. HCA sent out or put out a template, so we wanted to make sure that you all had that. And then HCA also did a really nice job of putting together guidance and steps on what to take when your PPE is critically low, like N95 respirators. So all of that is in a resource website, and I've included the link here in your update or this alert. So you have that as well. Next thing up is trainings. We've been notified by Alliant, who's our QIO, that they have a training coming up on November 19th at 2 p.m. Eastern and 1 p.m. Central to walk through the new CMS mandate to submit information, the point of care testing in NHSN. So just like we talked about a couple minutes ago. So if you haven't done so, register for that today. I've included a link on how to register in this update. And finally, Bruce did a nice job of collecting this information from one of our other members. We've heard of some communities struggling to find mortuary services when there are COVID-19 deaths in their facilities, particularly as we have these numbers rise so drastically. So if you happen to find yourself in need of this type of assistance, which we hope you do not, but if you do, we've included a contact in this alert for you. If you have any questions, please do not hesitate to reach out to us. We hope you have a spectacular weekend, and we will see you again next week.